Hi, I'm Dr. Noel Lucas, and I'm here to answer some more questions that you might have regarding your dog's lab work.
Dr. Lucas, how is blood drawn from the dog?
Yeah, great question. So we often will get blood from a couple different places on your dog. The preferred area, if they'll allow us, would be a jugular vein. I know it sounds a little scary, but dogs have beautiful jugular veins, and we're taught and trained as veterinarians and healthcare professionals to get blood from that area. If they're a little nervous or a little tiny or super hairy, sometimes we'll get it from their front leg, so we'll get it from the cephalic vein. And then rarely, but sometimes, especially if a dog doesn't like us to be up around their front legs or their face, we'll get it from a back leg vein. So those are the common areas that we get blood from dogs.
Is the sample collection painful?
Well, it is a needle poke, so a little discomfort or pain can be associated with a blood draw. We do distract them quite a bit with peanut butter and squeezed cheese and food and snacks and treats and love and, high baby voices. We're really trying to encourage them that this is going to be okay. If your dog is really distressed by us trying to hold them or restrain them in a particular way while we're trying to get a blood sample, our team is taught to stop, regroup, reassess. If we can regroup and reassess and get them comfortable and redirect them, then we'll keep trying. If they just won't have it, we will stop. We will prescribe some calming medications and then have your pet come back on some calming therapy and come back for a separate visit just for a blood draw, because we think it's that important that we get that sample from your pet, because we can't look inside. We need that blood to make sure that they're healthy on the inside as well as the outside.
Do seniors really need work done?
So seniors actually need probably lab work done more than any other age group that we have. We love to get blood work on a young adult, but we're really making sure that we have good normal values and we're establishing good trends for that dog throughout their young life. So as we get to their senior life, we know that seniors will acquire more diseases. They get cancers, they get kidney disease, they get liver disease, they get diabetes, they get hormonal imbalances. So we think blood work in that age group is the most important time for us to do blood work.
Will my dog need more than one type of lab test?
So your dog may need more than one type of lab test. That is true. So we're talking about blood tests primarily. So we start with usually just a general metabolic panel and hormonal, like thyroid checks and urinalysis. That's so important that we want to see that urine as well. But if we find something abnormal on those results, we might then recommend some additional testing. So maybe a special test like for Cushing's disease, or maybe a confirmation panel for a thyroid disease. Maybe we've detected something that we don't like with that liver, and maybe we want to do some diagnostic tests like ultrasound or x-rays. Maybe that we want to check a blood pressure. So having general blood work does not mean that your dog's not going to need any more blood work. It simply means we want to look and see, and if we find something that might lead us down a different path, we might recommend some additional testing.
And that's back to follow-ups. Are follow-ups really necessary?
Yeah. So follow-ups are really necessary if we find an abnormal result on your dog's blood work. Let's just say we find an anemia. It's really important that we want to verify that's true, or if we really feel it's true, maybe we want to do some additional testing to see why that dog's having some anemia. And then if we intervene or do something, we want to check and see, did that dog have anemia in 2 weeks, 4 months? We want to check it again. Because what if their anemia is getting worse, that we have something else going on that we haven't detected? So follow-up testing determines if the disease process is there and getting worse, or if our medications or therapies are working, or ideally that we've helped those organs and we've resolved the problem and everything's back into normal and we all feel better about moving on, that they feel healthy and we've cured something and everybody is feeling great. So recheck blood work is incredibly helpful, important, and required when we're treating and managing diseases. So if you have any questions about lab work with your dog, please partner with your veterinarian and other healthcare professionals within that team. We're super, super happy to answer those questions for you. And if you're in the Nashville area and you'd like to come to Blue Oasis Pet Hospital, we would love to see you. Thanks.